Hello, I am Dr. Ahmed Albeiyaly, nephrology consultant in the Ahmed Health Directorate. I am responsible for 32 hemodialysis unit in the Ahmed in Egypt. At first, I would like to thank ISN and our dear Prof. Ahmed and dear Prof. Sama Shahat. Really, this is the fifth course of ISN Ambassador Program. These programs really had a great impact in hemodialysis units in the Kahliya. We will discuss this great progress in the Kahliya hemodialysis units that results after ISN programs done in the Kahliya in the past 4 or 5 years. At first, today we will discuss a new subject or a special subject, which is administrative aspect of hemodialysis units in Egypt or in the Kahliya especially. The administrative points is very important in management of hemodialysis units to reach the success we needed. At first, we need to know what is the job prescription for doctors in hemodialysis unit. In the past, the doctors his job prescription was in just to assess blood pressure or general condition of patient. The doctors had little rule in administrative rules, which lead to many problems in the dialysis. Also, at first, to know what is the job prescription of the doctor in hemodialysis unit, we must know what is the difference of the work of a hemodialysis doctor than other departments in the hospital. In hemodialysis unit, we have machines, we have a water treatment unit, we have also a chronic patient which may undergo dialysis for many years. Some patients undergo hemodialysis 10 or 15 or 13 years old. Some patients reach 20 years old on hemodialysis. So it's chronic patient know everything about dialysis. So must be the team must be qualified well, because the patient is not cooperative when the staff is weak. So the job prescription for doctors in hemodialysis unit is the doctor is responsible for everything which occur in the hemodialysis unit, not just the medical service. Also, nurses. Nurses also must be work as a work team with doctors for observation if everything occur in hemodialysis unit. This is the job prescription for example, which is done by Ministry of Health. Some example, if we see the job prescription, we will observe some job prescription like observation of maintenance done in the hemodialysis, like this. Maintenance of hemodialysis units, observation for water treatment, observation for administrative problems in the hemodialysis. This job prescription of head nurse. So the nurse is not only produce the service for the patient. So the first items we will discuss in this lecture is water treatment. Water treatment is the most important part in the hemodialysis unit. Unfortunately, many doctors don't know where is the water treatment unit in his unit. So, in the first, we must know the component of water treatment unit. The first fissile, there is three types of fissile. First fissile is sand fissils, which is responsible for removal of any particles in the water. The second part is carbon filter. Carbon filter is responsible for removal of chloride. The third component in the hemodialysis unit is softener. Softener is connected with a salt tank containing sodium chloride. Is called softener. Third fissile is softener. Softener is responsible for removal of calcium and magnesium from water. Then the water go to RO. This is called reverse osmosis, RO. The RO is responsible for removal of all salts present on water and some bacteria and toxin presence in water. Then the water go to ultraviolet. Ultraviolet is responsible for killing the bacteria from water. The killed bacteria is catched by what's called then bacterial filter. Then the water is go to treated water tank. Treated water tank. We will discuss that now. What is this? This is the softener with salt tank. The salt must be cubics, not crushed salt or added with iodine. No iodine with this salt, pure chloride sodium cubes. This is UV ultraviolet lamp. Ultraviolet lamp, we must know two items. The lifespan of this lamp is 1 year. So we must observe the date of insertion of this lamp, because after 1 year the lamp must be changed. Some new water treatment, there is a digital screen, has a number in this digital screen. This number means the dates present in the lamp by days. As example, if the digital screen has number 200, means there is 200 days left for the lamp to be changed. This is bacterial filter. Bacterial filter must be changed every 3 months. This is responsible for removal of killed bacteria that killed by UV lamp. This is pressure manometer. Pressure manometer is responsible for observation of the bacterial filter. This pressure reading must be equal or no difference more than 2 bars between the two digits. This is the sample well taken from here. It is must be sensitized by stainless steel. We had sample every month. We take sample from every water treatment units every month and be analyzed by bacterial analysis and chemical analysis. Undergo chemical and bacterial analysis monthly. This is an example of other ultraviolet lamp. This is ultraviolet lamp, and this is digital screen, which we said before. Also, this is RO, the reverse osmosis part. Also, from this reverse osmosis, we can assess the capacity of water treatment of this water unit. This RO has three membrane, 1 and 2 and 3. Every RO membrane can serve about 7 to 8 hemodialysis machine. So this water treatment unit can serve about 24 hemodialysis machine. There is many new generation of water treatment. This is called direct flow water treatment. Direct flow, what is the difference between direct flow water treatment than ordinary water treatment unit? This has the difference is presence of tank of treated water. We had tank of treated water in the ordinary. This is tank of treated water in the ordinary water treatment. But in the new water treatment units, there is only a primary tank, no treated water tank, because treated water tank is a negative part for infection in the water treatment unit, because sterilization and this considered a dead space for progress of bacteria. Also, when machines begin to use the water from this tank, the air from atmosphere go to inside the treated tank, and the air of the atmosphere is not sterilized. So better to avoid water treated tank, and we substitute these units by direct flow water treatment units. This is an example of new modalities of water treatment units, which is called direct flow, which has a high flow of water to serve the machines directly without need of treated tank. Also observe the sterilization and the cleaning of this water treatment unit. We must consider the water treatment units produce a product which undergo intravenous of the patient, so must be completely sterilized and highly pure water. This also another example for new modalities of water treatment units. We also observe here there is three parts of softener, three softeners. Why three softeners here? This means the water comes, the primer water comes to this unit has many calcium and magnesium, so we need to increase the power of softener. So there is three part of softener here. Why water treatment unit is very important? Because it is responsible for many problems maybe occur for the patient, like anemia, like bone disease, like hemolysis, like hypertension, like metabolic acidosis, like muscle weakness, like nausea and vomiting, like neurological deterioration, like fever, chills, bacterial endotoxin. These problems may occur for the patient with inappropriate water treatment unit. Every day and every shift of dialysis, we assess the water treatment unit by estimation of what's called TDS and chloride and chlor. TDS means total dissolved solvent in the water. We give a sample of water and put this particle, this part of this equipment in the water. We read the reading here. The reading of TDS must be less than 30, less than 30, to be sure the total dissolved solvent in the water is in normal range. Also, we test the chloride every shift because the chloride is very harmful for patient if there is any chloride presence in the water. This test is done by sample of water, and then we put 4 drops of this reagent. If the water transformed to the yellow color, this means there is a chloride in the water, and the water dialysis must be stopped and not completed. Every shift we must do or check these 2 tests, chloride and TDS. This yellow color means there is a chloride in this range and the hemodialysis must be stopped. The second point, we must know the types of dialysis we need. We have low flux hemodialysis or high flux hemodialysis, HDF hemodialysis and HF hemodialysis. We mainly in Egypt and the Kahliya, we use high flux hemodialysis. HDF is less than 5% in Egypt. HDF, we use high flux hemodialysis. HFDF is done by this machine. In the Kahliya we had only 3 machines, HDF only. There is some types of dialysis also, which is called portable dialysis. Portable dialysis. This is many example of portable or home dialysis. In Egypt, there is not widely used, unfortunately. There is also many new types we see in dialysis. This types of machine is called Belco. This machine do undergo dialysis by mechanism called the HFR mechanism. Some molecules of waste product in the patient is bounded to albumin and is very difficult to be removed from blood by ordinary hemodialysis. This machine, I said that in Bologna in Italy 2 years ago. This machine work by this mechanism. This machine is insert 3 filters, 1, 2, 3 filters. The first filters is plasmapheresis filter, which separate the blood from plasma. Then plasma go to absorbent filter. This filter has a powder. This powder remove these proteins which can't be removed by ordinary dialysis. Then go to normal hemodialysis filter. This is plasma filter. This is adsorbent filter which has powder. With this is ordinary hemodialysis filter. HFR dialysis, the blood go to plasmapheresis filter, then go to adsorbent filter, remove the difficult waste product, then the blood return to ordinary hemodialysis filter in 3 steps. Also, I visit many hemodialysis units in Europe to see the design and the arrangement of hemodialysis units in Europe. Then we begin in Nagalia to change the design of our hemodialysis unit in the past 5 to 6 years, last 5 to 6 years, by these designs. We observe the many items like uh, the grid arrangement, HDF machines, also a good space, proper space, proper lighting of all hemodialysis units. 6 years or 7 years ago, the hemodialysis units in the Kahliya not well qualified. Then we begin to start to progress or develop this hemodialysis units, which and change all designs of our hemodialysis units like this. This is the Kernis hemodialysis unit 6 years ago. This is a water treatment in the Kernis 6 years ago. As you see, the space is very narrow, the cleaning is not good, the safety by electricity cables is not present at all. Now, after progress and development of hemodialysis unit in Egypt and the Kernis, this is the water treatment now in the Kernis hospital. Also, we observe hemodialysis machine like this. The hemodialysis machines must be, the screen must be for the doctors and nurses, not for the patient, for great observation of vital changes occur in the machine. Also, this some bodies put unnecessary component in the water treatment units. It's very great wrong. The water treatment unit must be clean and sterilized, and no one use anything, put anything not necessary in that, like this. Also this. Also this. This is good water treatment unit, but the tank is present in the floor, on the floor directly. What is wrong in the presence of the tank on the floor directly? The tank must be stand on. There is a stand below the tank. Why? Because drainage of the tank must be from downstairs, from down. Because if the drainage part of this tank become here from the lateral part, there is dead space in the last part of the tank, which has a precipitate. Also, this tank also has same negative problem on the floor. Put the tank on the floor directly, also it is wrong. Also, this is very horrible part, means the person working in this water treatment not know what is the importance of sterilization and the cleaning of hemodialysis unit. This is very wrong part for solution of standing the tank. Also, this tank is filled by, this rule is very wrong. Some units put bicarbonate mixing part in the water treatment unit. Also, it is very wrong. water treatment unit, only for water treatment unit, no any parts put in the water treatment unit. Also, water treatment unit must be closed, not opened by like this. Must be closed, and we put air condition or a fan only, not open to outside. Also, mixer of bicarbonate inside water treatment, it is wrong. Every month we take a sample from water treatment unit. This is an example of the result of samples. This part is chemical analysis, and this part is a bacterial analysis for water treatment unit. This example of sample failed by bacteria, and this sample failed by aluminum intoxication. When water treatment unit sample is failed, we must be maintained in 48 hour quickly, rapidly, and everyone is responsible for this matters because it is very important problem. This is a portable water treatment unit. Portable water treatment unit used in ICU dialysis. When we need a hemodialysis machine in intensive care unit, we can't preserve that without water treatment. So there is a portable water treatment, small water treatment unit can be put in the ICU and use it with machine beside that, like this is water treatment unit, and the hemodialysis machine is beside that in ICU for ICU dialysis, for urgent dialysis. Also, this is another example of portable water treatment units for ICU. Also, the documentation and the registration of data is very important items, which in the past has a very big problem in that. We had many documentation must be registered now and arranged, like monthly analysis for hemodialysis patients, like virology, like waste product, like hemodialysis sheet for the patients, or like the training courses, like blood transfusion registration. Well, also the maintenance documentation also must be documented now and registered in files in the hemodialysis unit. We must observe the regular the laboratory analysis for the patient carefully. Like this patient, hemoglobin is 18. The months before is 7.5. This is something wrong. So when we observe what is the problem, we observe the problem when the nurse write the results here. The result is documented wrong. The real analysis paper, the patient was hemoglobin 8. So we must be register everything in the documentation by carefully. Also, all patients must be assisted by URR and KT over V. We observe KT over V is abnormally assisted. KT over V is registered 4.3, 5.8, 6.2, This is wrong way for assessment. So we must be careful in assessment of everything in hemodialysis unit. Also, lab result here, we observe creatinine of hemodialysis patients all to 2.3, 1.8, 1.2, 2.4, 2.2, 2.5. All this not this result is wrong. So many hemodialysis unit complaining from the lab result is not well done. So we must be calibrate and reassess the lab results carefully from the doctors and recheck on and redo every lab which we observe it is not normal. Also, we observe like this result. The urea before dialysis 10.4 and urea after dialysis for 242. This is not realized. Lab results here in this hospital is not clear. Also, physician progress note. We observe and there is problem in physician progress note. This is not progress note. This is orders. So the doctor must be done his observations by regular manner and be careful in the data registry of everything done for the patient during during hemodialysis. Also, virology. We in Egypt we do virology lab every 3 months for all patients. We do hepatitis C antibody, hepatitis B surface antigen, and HIV. These three labs done every 3 months for every patient because we had complete separation and isolation for patient considered about virology result. Also, we must be this is some example of our hemodialysis unit. We must be observe everything care in our hemodialysis unit carefully. This is some wrong as we observe. This mean there is weakness in the observation of administrative team in the unit. Also, this water in the floor means there is the system of the water treatment it's not completely closed. This help in failure of the sample of water treatment unit because this help in the humidity and also progress of bacteria in the water treatment unit. There is also problem here in waste product basket. Waste product basket is beside dangerous waste product beside the dialysate. It's very dangerous and very wrong, so it's problem. Also, there is another wrong in this image in the machine work in preparation. It's also very wrong because preparation may miss many alarms for many problems may be occur for the patient during dialysis. Also, there is the same problem here. The machine work on the patient on preparation. It is very wrong and there is very big problem. Also, this machine work by preparation also. So this point will work to prevent this point from all hemodialysis now. Every patient must be undergo dialysis on dialysis program on the machine. this unit has a problem in spacing. Proper spacing between machines is very, very important. We have a space at least 1.5 meter between every patient. This is not present in this unit, so it is very difficult and very dangerous because infection controlling in this unit is poor. Also, this problem is blood transfusion for the patient, not through machine. It's very wrong. Blood transfusion for hemodialysis machine must be through the machine because potassium load in the blood must be in the transfused blood must be washed by hemodialysis machine. One of the important items we must be considered in our units, the supply. The supply we used must be we must be know every supply we have, every types, the amount of supply we had, the stores of this supply in proper site. This false site preservation of this dialysate here, because the sun can affect for the dialysate particles, and also contamination of this dialysate, so it is very, very wrong. And now many units preserve the dialysate through agronomics, but it is very expensive. We can't preserve the dialysis by agronomics like this because it is very costly. Also, we must be weekly collect all the types of supplies present in the unit, because if there is any type of any supply has a shortage, we take steps to preserve this type or these items. Also, the government help the patient to help in the preservation of many medical services for hemodialysis or renal patients in general by this is government cover the treatment of chronic kidney disease medical treatment. This is dialysis service. This is for dialysis service. This is for AV fistula service. This is for AV fistula service. This is for permicast service, also permicast service. This is for treatment of anemia by erythropoietin. This is for plasma transfusion, for plasma exchange, this is for transplantation and drugs or treatment after transplantation. This is for temporary catheter. Also, treatment of mineral bone disease by cinacalcet. Also, treatment by virus C, from virus C. Virus C in the past was a big problem in Egypt. About 75 of hemodialysis patient in Egypt was hepatitis C positive, but now less than 15 percent is hepatitis C positive now. So the percentage of hepatitis C patient is greatly decreased in last years after treatment of hepatitis C virus for hemodialysis patient. Also, maintenance is very important to regular check of all hemodialysis machine and follow up this regular check because the safety and prevent of any maintenance problems may occur to the patient. And we have a data registration for every hemodialysis machine, for every machine for maintenance. Also, when we develop many hemodialysis units in the Kahliya in past 4 or 5 years. Every problems which we discussed above, which it changed in the past 3 4 years. We change all designs of hemodialysis units and become greatly developed in the past years, like big hemodialysis unit. Now, this is some example of hemodialysis now after development in the Kahliya, after treating the negative items we discussed before. This is meat lumbar hemodialysis unit, as we see, become in great level like the international hemodialysis units. There's also mid lumbar hemodialysis unit in the Kahliya now. This is material hemodialysis now also after development. There is also Atmida hemodialysis unit now after development. Also this is Atmida hemodialysis unit. This is Belkas hemodialysis unit. Belkas is one of hemodialysis units we arrange ISN ambassador program also about 2 years ago with Professor Ahmed and Professor Osama Shahad. This is Aga hemodialysis unit hospital. This is Miniyat al-Nasr. Miniyat al-Nasr is the first ISN program arranged in Miniyat al-Nasr. And after the ISN program, we begin to build this building, great building, 5 floors, only for hemodialysis, very big hemodialysis center in well qualified manner, as we see. This is the Kernis ISN program now is the Kernis ISN program. The Kernis has a great development in past 2 years in quality and service in hemodialysis. This is hemodialysis in the Kernis now. The Kernis in the past was this. This is the Kernis 3 or 4 years ago. Was very poor and not well qualified, very bad. But now the Kernis is hemodialysis unit in the Kernis after great developments in the Kahliya for every hemodialysis units now. We also had now many hemodialysis units with great progress, like Al-Aziza Manzala. Also, this is hemodialysis unit in Al-Aziza and Mansala. Also, one of our hemodialysis units which is greatly developed. Also, this is called Gafretera hemodialysis unit. Also has great development in the past years. Also, this is Al-Shawami hemodialysis unit in Belkas. Also, great development. Also Tanah is also a peripheral hemodialysis unit which has a great development. This is intervention room in Tanah hemodialysis unit, and this is the doctors insert permi case for this patient. Also, this is common or one of the new hemodialysis units, which has great level of qualification. Like as we see, this is the waiting part for the patient before dialysis. This is entrance of the hemodialysis unit, or this is سلمون امدقالية. So we must work in a team work, doctors, maintenance, nurses. Nobody said this is not my work or this is not my job. No, everyone must be help the other to be reach the success, and we must be work for continuous development and solution of any problems to develop the hemodialysis unit. As we see, in 4 or 5 years, every hemodialysis unit in the Kalia has great progress from the image which is seen in the image photos in these lectures. It was very poor, so become now it's very amazing hemodialysis units in the Kalia. And finally, I thank you for your attention, and great thanks for our dear Prof. Ahmed Al and Fusama Shahad and ISN Society, and thank you.